Hello. Today, we are going to talk about the effects of mindfulness on insomnia. First of all, let's define the term mindfulness. Mindfulness originates from Buddhist tradition and is a key part of Buddhist meditation. It was adopted by Western psychotherapy and it is described essentially as a state of non judgmental awareness. The state of calm awareness of our own mind, thoughts, and sensations can be cultivated through mindful meditation practices. Here are some specific therapy programs of mindfulness. Firstly, MBSR, which is mindfulness based stress reduction therapy, is an 8-week program that consists of body scans, mindful breathing, stretching, eating, and awareness, as well as perceiving one's inner thoughts. MBCT, so mindfulness based cognitive therapy, uses meditation to change maladaptive thoughts and behaviors. It is also used to counter rumination, which keeps people in a depleted state of mind. Among the many benefits of mindfulness are emotional regulation. So, mindfulness helps reduce rumination and increase awareness of one's thoughts, which in turn helps regulate emotions. Second is decreased emotional reactivity. So, it's been shown that mindful meditation activates parts of the brain that promote adaptive responses to stressful situations. Insomnia is a sleep disorder diagnosed and characterized through different criteria. First of all, there needs to be a difficulty with falling or staying asleep, or waking early in the morning and not being able to fall back asleep. Then, these difficulties must happen regardless of the quality of the conditions for sleep, and there must be significant daytime distress associated with the lack of sleep. Finally, these disturbances must happen at least 3 times a week for 1 month. Some of the most debilitating consequences of insomnia are that it is highly comorbid to other psychological disorders, especially depression and anxiety. Insomnia often preceding a mental health disorder when there is co occurrence. Then, in terms of physical health consequences, insomnia highly increases the risk of accidents. Insomnia is also often associated with a substantial overall decrease in the quality of life. Some of the most popular forms of treatment for insomnia include sleep hygiene, so creating a schedule and good habits for the promotion of sleep. Insomnia oriented cognitive behavioral therapy is also used. Pharmacological treatments consist mainly of non benzodiazepine hypnotics. It has been argued over time that insomnia was caused by hyperarousal. In this model of the potential cause of insomnia, primary arousal consists of a multitude of maladaptive thoughts and beliefs about sleep and a lack of sleep. Secondary arousal is the level of importance and attachment one associates with these very thoughts and beliefs. The degree of acceptance of these thoughts as facts then aggravates their impact, and so on. So, for example, if someone believes very strongly that they should go to bed every night before 11, if this ends up not happening for a number of reasons, they will be highly aroused in a negative way. So, why mindfulness for insomnia? In the arousal model described earlier, the source of arousal that significantly impairs sleep is found in the level of attachment one applies to beliefs about sleep. Mindfulness helps people detach from their thoughts, refrain from judgment, and find more adaptive ways of reacting to upsetting situations. According to an important 2016 meta analysis of 6 randomized controlled trials, observing the effects of mindfulness practices on subjects suffering from insomnia, mindfulness meditation did increase sleep quality as well as sleep efficiency. A 2020 randomized controlled trial of MBCT given to cancer survivors with insomnia also found that mindfulness enhanced sleep efficiency as well as decreased sleep onset latency, had less waking during sleep, and increased sleep time. However, another 2019 randomized controlled trial found that although MBSR had positive effects on insomnia in the short term for people who developed insomnia after cervical cancer, the long term effects of the treatment were not significant. Although the effects of mindfulness as a treatment for insomnia are promising, more research needs to be done in order to yield solid results on its relevancy.